Okay guys, today I'm going to talk about myasthenia gravis and Lambert-Eaton. They can be a little bit confusing, so it's important for USMLE to know the differences between the two. So myasthenia gravis is the most common neuromuscular junction disease, and it's it's an autoimmune process. So usually when you think of myasthenia gravis, think of anything having to do with a thymus. So a thymoma, or if there's an autoimmune reaction against your thymus, that's correlated. A lot of studies have done that it's correlated with myasthenia gravis. So myasthenia gravis is the postsynaptic neuromuscular receptors for acetylcholine are attacked. So you only have a few that are left because this autoimmune process starts getting rid and destroying these receptors for acetylcholine. So the person, whenever they wake up, they feel better. So they feel better because there's acetylcholine within the synapse. And so when they wake up, they feel fine. But as soon as they start moving and going about their day, they are using up that acetylcholine. Acetylcholine is being broken down, and they start having ptosis, which is like, you know, when your eye kind of falls down like that, double vision because the ciliary muscles and, you know, the iris muscles, all of that becomes weak, and so they start having double visions, as well as the extremities become very weak, and they feel tired. A good treatment option, which even dogs that have this disease, they're given neostigmine, pyridostigmine. These are the drugs for humans. I'm not sure what they're called for dogs, but it's basically an acetylcholine esterase inhibitor, acetylcholine esterase inhibitor, sorry. And what that does is that the acetylcholine that is within the synapse, it doesn't get broken down. So instead, it just stays there. And I mean, when you think about it, the more acetylcholine there is to bind to those few receptors in the postsynaptic neuromuscular junction, the more easier it will be for you to be able to like blink and move your eyes and move around. So the improvement is pretty significant. Now Lambert-Eaton is a different process. So you also get weakness, not as much eye problems as you do with myasthenia gravis, but you definitely get the weakness. But what it is, it's the presynaptic calcium channels that release acetylcholine. Those are attacked. And usually those are in paraneoplastic disorders. So whenever you think of lung cancers, if the question gives you something about lung cancers, also vitiligo patients can also have Lambert-Eaton. So it's the presynaptic calcium channels that release acetylcholine that get attacked. And if you don't have that, then there's no acetylcholine being released. So think about it. If there's no acetylcholine within the synapse, would the acetylcholine esterase inhibitors work? It wouldn't, because there's no acetylcholine for them to like help to not break down, because it's not there in the first place. So that therapeutic option does not work. The best therapeutic option you can do is if there is an underlying problem, you know, if they have cancer, paraneoplastic, give them chemotherapy or give them anti-inflammatory. Sometimes IVIG can help, things like that. But these patients, unlike myasthenia gravis, actually feel worse in the morning, and they improve throughout the day because the few calcium channels start releasing a little bit of acetylcholine. So, yep, that is the differences between the two and the mechanism and therapeutic options. Hope this was helpful.